Hello, this is Janet, and my topic for the task which was assigned was about a 91-year-old man with South Korea and Finland involved. And the main disease study I was having was about SARS. So, SARS is the severe acute respiratory syndrome. So, this is a viral infectious disease which began in the year 2002, 2003, and the epidemic affected a number of continents, if not all, but with a total number of 26 countries involved. The main countries which got severely affected included China, where it's believed that the disease started, and before spreading to other countries, that is, there was Hong Kong, Canada, Taiwan, Singapore. And with the World Health Organization reports that the virus was thought to have started from, if not a specific animal, but perhaps a bat. And then this spread to other animals and then to human beings. So I was just a little bit curious about the bat thing. And then I have my references down. So for references, you can check my pinned references. The first infected humans were in Guangdong in South China. I do not pronounce that. The contagious lung infectious virus affected most health workers, providers during that time. So those were the doctors, the nurses, and of course their families. The causative agent was quickly identified through the international collaboration as a new strain of coronavirus, SARS-CoV. It was sequenced by the Michael Smith Genome Science Center in British Columbia, helped by the BSc Center for Disease Control and Winnipeg's National Microbiology Laboratory. More than 8,000 people were affected during that time. Worldwide, and going by the eBooker's central request, the links are down. I came across these figures that 774 people died in China during that time, and Hong Kong recorded 299 deaths, with Canada recording 44, 37 in Taiwan, and 33 in Singapore. But to my surprise, it was that the countries which I'm working with, that is South Korea and Finland, none was recorded. No any death was recorded, and I tried to Google. There was a little bit some news on Wikipedia, like there were some rumors about patient dying in Finland as a result of SARS during that time, but then I couldn't find clear references about that. But going with the that was in the Sano Malete. There was a news that there was a Finnish citizen who was that was in the international. No, it was in the Scotland. This let me just open this to get the clear information. So this was in Sanomalete, Helsinki Sanomat, and then there was a Finnish citizen who was visiting Peking, that is in China, and he died as a result of corona. Not corona, but SARS. Yeah, so the links are down on my towards the end of my work, and yeah, so there was one death report about a Finnish man in China, and this man was going by that, it was showing that he met this during his travel in the plane. So I couldn't get more information about this. I tried to look, but there wasn't much about this. But yes, it was reported This was a paper on the sometime in, well, the reference is down, so I can't find exactly what time was this, but it's down on my, it will take time for me to get that. Yeah, so yeah, there was one death of a Finnish citizen in China, but that was not in, he was not in Finland, so that happened in China. And actually with South Korea, they didn't report any death. And I was just a little bit curious, like, as to why. Then some of the reasons I got as to why they didn't report any deaths was shown somewhere down there. I will show you that too. Back to my work. I was also a little bit curious as to why, how, and from where did SARS start from. And I came across this, that SARS entered global history when 64-year-old Dr. Liu Yanlong, that was a physician and a professor of nephrology, stayed in the Hong Kong hotel in February. And then some note with irony that he occupied, there was a room number, room 911. But global terrorism during that time, also impending war in Iraq, were realistic fears during this time, and were easily linked to the vague rumors of a novel epidemic spreading through the southern China. Coming from Zongshan, I think the cities in China. He was attending a family wedding, and he developed severe pneumonia and was admitted to the hospital, where he died on the 4th of March in 2003. Meanwhile, recognizing the danger alert, the WHO alerted the World Health Organization offices in Geneva and coined the acronym SARS for the man's cause of death, and himself became the most noted victim of the outbreak, dying a month later in hospital. And then I also got a little bit curious how this happened with Canada. Why was Canada in question, like, whereby most of the countries which were affected were in the Asian. And then, so this also happened whereby so the question came up, why did SARS come to Ontario? And it was reported that one of the Canadian citizens ended up in the same hotel during that time when the doctor was there. And then the first Canadian patient was a lady who stayed with her husband on the 9th floor of the hotel. So most probably, if they were in the same hotel, at some point maybe they were using the same lift, or you never know, So this is the time the citizen was visiting, and then it was the same time also whereby the disease was smoldering in China for some months. Highly infectious at the time of this visit, and spread as widely through Vietnam, Singapore, Canada, and the results. So a total number of 8,000 were recorded. 8,000 deaths were recorded. I've shown that, and also that is in my references. And then about the SARS, it was a little bit interesting that I think it's more of the same family of coronavirus, the main thing we are going through now. And the control of the outbreak of this novel pathogen was achieved through ancient methods, old-fashioned public health measures like the normal hygiene, the hand washing, infection control procedures, isolation of cases, and tracing and quarantining of contacts. There was strict isolation of sufferers and quarantines of their contacts. In Canada, cases spread in Toronto. Few people outside the country realized that the hospitals across the entire province of Toronto was quarantined during the acute phase. So it's just more of the same of what is happening now. There was just more of hand washing, sanitizing, and if the doctors and all the healthcare providers, it was more of the PPE, and the new rituals of hand washing and temperature monitoring were taking place. And going by my what I worked on, so symptoms were more or less the same. Influenza like included fever, malaise, and headache, diarrhea, shiver. No individual symptoms or cluster of symptoms has proved to be specific for a diagnosis of SARS, although fever is the most frequently reported symptom. It's sometimes absent on initial measurements, especially in elderly and immune like the weak immune, the like the risk groups. So there is also an example of cough and initially dry, shortness of breath, and diarrhea are present in the first and in second week of illnesses. So severe cases often evolve rapidly, progressive to respiratory distress and required intensive care. As I was going through my work, and then after I realized that there wasn't any cases reported in South Korea, I became a little bit curious, and I came across some information when I was trying to check on the SARS in South Korea. And then there was this thing which came up, and I'll try to, despite the worries, however, there has been no officially known SARS patients here in Korea report. Yet many would wonder what is keeping SARS from taking over Korea, and kimchi could be an answer. So I was a little bit curious about what kimchi would be. And then when I googled to kimchi, actually I came across it's more of it's a cabbage, garlic. So I don't know if you could see that. I'm not so good in doing this. So that's, oh, the color is a little bit funny. It's not green. So it's a cabbage though. So it's not that the color you're seeing there, but it's more of a cabbage. So kimchi, a picked cabbage seasoned with the garlic, red pepper, and ginger is traditional staple in Korea. Kimchi has recently broadened in boundary to other Asian countries such as Japan, and it has become popular by now, going by this report. And as SARS failed to penetrate Korea, some efforts to draw out the reasons from kimchi have been made. The studies about kimchi preventive effects on SARS have become so compelling that story about kimchi and how it prevents SARS. So I also put that in my references if you might be interested. And there was a little bit an interesting picture. I don't know if I'm able to turn my camera, but if it doesn't work, then it might not work. So I might end up spoiling my video. Yeah, so there was a story behind kimchi, and so they believed that as a result of the food, they were lucky not to be affected by the disease, by SARS virus. So garlic, so kimchi, garlic, and some kind of traditional food which they use to fight against this. So for example, garlic can be used as a remedy to flu, has already been proven by Standard University professors. SARS is speculated to be caused by coronavirus, which caused respiratory diseases such as flu. So Dr. Hong explains that garlic in kimchi could react against SARS virus in the same way as garlic does against flu. Yeah. So the spreading information of kimchi effectiveness in preventing SARS coincides with dramatic disease in kimchi product sales is overseas market. Well, I'm not so sure of that, but then the references are down. So even though kimchi has received better recognition than ever before, a lot of foreigners are still reluctant to try kimchi because of its stinging smell and taste. I'll not wish to try that. Yeah, so South Korea was lucky that it didn't record any, and to me, the story behind it, why they didn't record any death or anything like that, it was because of their traditional. I'll talk of the food they ate or something like that. But then in Finland also, we didn't have anyone. So, and the man who died in China during that time, this was in this which Sairala was that? The news was about uh I'm not able to this was Aurora Sairala. So if you go through my references, you're able to see that. So, but definitely with the 91-year-old man, a good example of what is going on now, you can even see that the mostly affected people are the people in the risk group. And of course, a 91-year-old man will be one of the people who will be easily affected. And for that case, I think we would work so much of the guaranteeing to them if this was to happen. And then, of course, they love to be like, take care of themselves and take notes and, just stay at home. They will stay at home and that will be it. So that was in South Korea, and then Finland. So nothing much was recorded. But of course, with 91-year-old man, considering the immune system, the weak immune system, and the early other related diseases which might be there. So definitely they will be in isolation or in quarantine. Yeah. Whereby they don't have to have direct contacts with people. For example, they will not be able to visit shops. Like exactly what is happening now, that they'll have to stay home and be safe from meeting other people. And then if they were like if they were like by any chance become sick, of course they'll have to be in quarantine. And with SARS also, the incubation period was more of 2 weeks. So for example, if you might have met somebody, or maybe you might have thought of having met someone who was it, then you have to be in quarantine for 2 weeks to be able to know the results, or before you can be able to take the tests. And of course, the risk groups also are the kids, the infants. But for my case, it was 91-year-old man who stands a high chance of becoming sick. So a conclusion of my presentation. SARS outbreak of 2003 helps to create a new dialogue with past plague history, experience of providers and first respondents within the complex and various issues that plague raised long ago. We should not minimize the difficulties of perceiving the initial phases of an epidemic for emerging infectious diseases are increasing in global experience. Secondly, we are surprisingly finally beginning to see the patterns of risk redistribution and the burdens on nurses and paramedical personnel. While the Chinese Ministry of Health initially downplayed the context and several of a novel typical pneumonia that appeared in Guangdong province during that 2002-2003, the epidemiology and virology learned about SARS after early March 2003 could not have been pieced together fast enough to prevent its spread. 74 scientists do not typically work from rumors, and it was less than a year elapsed from emergency of the pathogen to its identification and control. And impressively short interval, there are similar reasons to feel lucky. Control was easier to affect because infected individuals become infectious when they become ill. So the same still goes, like it's always easy to control, to prevent before you can cure, because if you stay home, if you wash your hands, if you sneeze carefully and sanitize your hands and just disinfect, then you stand a high chance of staying safe from this. So that was my case. That was SARS, South Korea, Finland, but of course, these my countries were not affected, as I mentioned before. And all my work, all that I've done, the references are down. You can find that in my learning diary, and of course, when I'm attaching my video, you can find the references down. So feel free to comment on my video, like it, and if you have any questions, please, we're here to learn. So just share, and then we are going to learn more. But then, yeah, this was interesting that SARS is just the same family of coronavirus. Thank you.